Good afternoon and welcome back to the Lynn Lowdown. I'm Danny Vittori, and today we have on 3 representatives from Spectrum Health Services. Thanks for coming on today.
Thanks for having us.
Great, so first question is, could you mind just introducing yourselves and your relation to the program, please?
Sure, thanks Danny for having us. My name is Athena Haddon. I am the Executive Director of Peer Services and Recovery Supports for Spectrum Health Systems. I oversee the newest, one of our newest programs, the Lynn Peer Recovery Center, the Recovery Exchange at 35 Exchange Street here in Lynn.
Hi, I'm Jackie Hyde, and I am a patient at the Saugus Clinic, Spectrum.
And hi, I'm Christina Rossi. I'm the Regional Executive Director at Spectrum Health Systems. I oversee 5 of our outpatient sites: Haverhill, Saugus, Waltham, Weymouth, and Framingham.
Great. So one of the first things we're going to talk about today is the MOUD Treatment Act. And I know, Christina, you said you could speak a little bit on that, and how will that affect individuals getting treatment?
Yeah, so this was a great change for us. This really positively impacted our patients by expanding access to take-home medication for addiction. We know that medication is the frontline treatment for addiction treatment. So this expands access and allows patients to have more access to take-home medication, allows more flexibility to take-home medication. So this has been a really positive change for us. Patients, have really shown that they do really well with the flexibility of having expanded access to the medication. So it's really making our patients' lives easier and allowing people to remain actively engaged in treatment, in medication-assisted treatment specifically. So we're really excited about this change, and we've seen some great benefits already. And this change really happened as part of the pandemic, and we really expanded take-home flexibilities during the pandemic. And that really showed us that patients are more than capable of taking their medication safely and responsibly. And it really showed us really how much benefit it has to our patients to have that expanded access. So we're super excited about it, and so far it's really off to a great start.
One of those silver linings, and I saw, Jackie, you were nodding really a lot when she said that. Do you want to add anything?
Yeah, I used to have like 12 or 13, and I thought that was wonderful, but the 27 is just great because I take care of my mom and my daughter's special needs, and it's hard to just leave and go at any time I never know what's going to happen. So it's wonderful having all those take-homes. It is wonderful. I love it.
And that's a great point, Jackie. And, prior to this, our patients had to come into the program 7 days a week.
Wow.
So that's a lot, being somewhere 7 days a week, especially if you have children or parents or family members to take care of work. So this just allows that flexibility. I know I couldn't get somewhere 7 days a week, so that's a real challenge. So now patients can have anywhere from 1 up to 27 take-homes. So
Wow.
yeah, it's really helpful.
It's great.
That's a great benefit for it. And Athena, you're on the side of recovery exchange, so people who are in recovery and interacting with each other. Have you seen this change affect them at all or help them?
Sure, I think anything that is easier access for our populations that we serve is going to benefit folks in their recovery. So I'm very happy to see it as well. The relaxed guidelines. I often the guidelines the way they were. We used to hear a lot of people come in, and for little things they may have either been kicked off the clinic or they weren't allowed take homes, and it really impacted their day-to-day. I heard Christina say she couldn't do something 70. So often we had our patients doing things that I couldn't even do, be somewhere every single day at 7 o'clock or 8 o'clock in the morning. So to have the flexibility now, people can go on with their lives.
Mm-hmm. And I'll ask a little bit, how does, talking about take-home medication, how exactly does that work? Like, what is the process like?
Yeah, so patients the program and they start by taking their medication in person. And once we can see that patients are able to take their medication in person responsibly and safely, and they're able to provide some screens that are negative for opiates, then we're able to provide them the take-home medication if it's something that they want. We're really focused on individualized care. So if it's something that they want and they feel like could benefit them, we'll support them in getting that medication. So they have to present to the program, a nurse administers it to them. They have a locked box where they can keep it safe and secure, and they take that home with them. And it's a big responsibility. They have to do bottle checks and sometimes get callbacks and things like that. And as part of being in the program, they meet with a clinician. A lot of times they go to groups. So there's a clinical requirement too. So, it's not easy, but these guidelines have made it a lot easier. And again, we're just really wanting to do kind of what's best for the patient.
And Jackie, you've been in recovery now for many years, which is incredible. How has the experience been for you working with Spectrum and working within these various programs?
It's been great. They're very supportive. Like, no matter what I need help with, they're there for me. And if they can't do it, they will find someone that will be able to help me.
And you were even mentioning before, they'll offer classes or treatments beyond the addiction.
Yeah, stress,
groups, other things.
Groups for stress, quitting smoking, anger management, and all different types of things.
Which is great because it's all connected, right?
Sure.
Yeah,
And
you can
then
talk about that.
sure, at the Recovery Exchange, we have a full calendar. I brought a calendar, and it's on our Facebook page, but we have a full calendar of things that go on. There's gender-specific groups. There's all kinds of supports for people as they begin their recovery journey.
And why is it so important to have that piece in addition to the medication, but also having the social?
Having recovery supports is very important. I mean, together we can, alone we can't, right? And so that's kind of that's how we think about folks in recovery. The recovery supports, having those peer relationships, very important. There's going to be a time that the clinic's going to be closed, or the therapist isn't going to be available. We just had a long holiday weekend. Yeah. Those are the times that these peer recovery supports are really important. In the recovery centers around the state often have things going on those long holidays, on those after-hour places where the peer supports are in place. We have now 40 peer recovery centers statewide for the Massachusetts. Spectrum hosts 5 of those centers. We're fortunate to have the one here in Lynn. But they're very important. They're as valuable as senior centers. They're as valuable as youth centers and communities. So we're seeing that grow because we know the benefit.
Definitely, and I remember I went to the opening
Awesome.
of Exchange, and it looks like you have such a supportive network there. And I'll ask, how do you think that the evolving rules and really the focus to addiction can benefit those in it, trying to reduce the stigma towards them? And then you can answer.
Yeah, I would just say that, any other medication, you don't have to show up somewhere and take it 7 days a week. So we really want addiction treatment to be that same way. We don't want the stigma associated and to have people, have to show up, 7 days a week. So we really want this treated like any other medical condition. So I think that in itself helps to reduce the stigma. So we're really excited about that piece of it because we know that stigma is a huge barrier for getting help and getting the treatment people need.
And one thing I actually underlined is you said education is the foundation of all of these programs. What specifically does that mean? Educating patients, general population, everyone?
Yeah, certainly educating people about addiction. Folks, when you go into a doctor to see about any other illness, they're going to educate you about your illness, if it's cancer or high blood pressure. So educating folks about addiction, what triggers look like, things like that to help them and support them. And then we also educating the community. That's what we do a lot of at the recovery centers, right? Yeah.
Again, Jackie, I'll ask for the patient perspective on that. Much work has been done, but looking forward, what do you hope continues to happen with your experiences?
I hope to maybe be off the methadone eventually. But I love going to clinic and seeing them. They're very good supportive. If it wasn't for Cassandra, I probably would have went to half my appointments. So they're very good support.
I can definitely tell the way that the passion about it and the way that you all care about it. And I have to ask, I will be wrapping up in a moment, but is there anything else that I hadn't mentioned that any of you wanted to mention about medication, peer support, anything like that?
I just would like to say, if anybody hasn't walked into 35 Exchange Street, please do, and really just see what happens. And I think we're at a place where everybody's been affected by addiction, right? We all know somebody, if we don't, you know, in our families or in our friends, everybody knows somebody. So I think I'd love to invite everybody to come and visit us at 35 Exchange Street.
Great, awesome.
And along the same lines, you know, if anyone has questions about medication-assisted treatment or they're wondering if it's the right fit for them or their family member, you know, I would encourage them to give us a call, reach out to us. We're always happy to have a conversation to see if it's the right fit for you. We have a bunch of friendly staff, as you mentioned, Jackie, so we're happy to talk to you about it. And we have a lot of friendly patients, too, that are happy to welcome new patients to the program.
Well, it all sounds like such an amazing support system, and I want to thank all of you for coming on to really help raise some of that awareness.
Thank you.
Thank you.
Thank you anytime. And once again, I'm Danny Vittori. This has been the Lynn Lowdown, and we'll see you next week with more guests.